Hello, everyone. My name is Melanie Ferris, and welcome to our live stream, our engagement session for Leaf Rapids residents. We are broadcasting live to MKO's Facebook page, and we're also broadcasting on NCI FM. Thank you, everyone, for joining us. I am going to let you know what our agenda is for this evening. And I just want to say welcome to everybody. I'm going to be the MC for this engagement session today. It's on behalf of Manitoba Kiwatnai Okimakanak and Kiwatnuk Ininu Minaw Yawin. And I apologize for my Cree. I'm still learning. I'm going to refer to our two organizations as MKO and KIM. So if you hear those acronyms today, I'm referring to the political advocacy body and the health entity that we work with. I want to welcome everyone, and we are joining you. I'm joining you from Treaty 1 territory. I'm very pleased to be here with some experts today to share information about healthcare in Leaf Rapids. We have a number of speakers, including a Leaf Rapids resident, and I want to thank you, Liz, for joining us today. Residents of Leaf Rapids have made it clear that they have a variety of concerns about healthcare in their northern town. MKO and Kim have organized today's session as we want to share information with Leaf Rapids residents. We want to work with the province on transforming the healthcare system in the north. We have organized the broadcast to share information, but also to seek direction from the people living in Leaf Rapids. We will begin by having an opening prayer from Grand Chief Garrison Setti. I will then invite our speakers to share their reflections with us. Our speakers this evening are Liz Cherrier of Leaf Rapids, Dr. Barry Lavallee, who is the Chief Executive Officer of the health entity KIM. Also joining us this evening are Dr. Yvette Emerson. She is a medical advisor to our organizations, and Dr. Emerson has recently traveled to Leaf Rapids to spend some time at the health center. Once all the speakers have shared their statements, we will have time for conversations with any questions that come up. As we proceed, I encourage people tuning into the Facebook Live broadcast to share any of your questions in the comment box. If you're listening on the radio and you want to tune into us, our broadcast on Facebook, you can search for MKO to find it. And if any media are tuning in virtually this evening, they can feel free to email their questions to me. And I want to thank all the speakers for making time to share with us this evening. And now I'm going to invite Grand Chief Setti to provide the opening prayer for us. Grand Chief.
Tante, ne tutte magnici sana niwago maga nagtatabiskat now. Anos kati piskat na specialmente man e peviche tago gumautaga etawag at simuina awi pagit negate gi pigiskwena magam pagusene mun taso ni tago siya gageno kan tutamek nutawi nan gichigisigo ginanas commit nan isimama wiyaga no tutaga gisiga kati tipiskak taso ni taman pigiskwena awi pagit negate gi so ni mag ni wakiwet no may mustamuagok Taminoyamente utito kuchik inanas commit nan tatugisiga megano miag inanas kumaga genege gono chiminoyane pagoseni muago sime. Creator God, we're thankful for this opportunity to reach out to our nations, our citizens in MKO territory. We pray for the health of our citizens, our people, our nations, and their communities. We pray that you'll continue to give us the strength and the guidance to move through this pandemic. And we pray for the citizens of Leaf Rapids. Everyone that is listening, we ask for your blessing upon their homes and their families and their community. Because this is an askament. I hope.
Thank you, Grand Chief, for the prayer. So we're going to open now with our speakers, and I'm going to introduce you to our first speaker, who is joining us from Leaf Rapids this evening. We are on a Zoom call virtually for those listening on the radio, and her name is Liz Cherrier. I'm hoping that I'm saying her last name right. She is a mother who wrote a powerful letter to us outlining her concerns that she has in Leaf Rapids. She had over 100 people join her in signing her letter. And I'm now going to ask Liz to read part of her letter to you so you can hear the concerns that she shared on behalf of many citizens of Leaf Rapids. Liz, please go ahead.
Hi, good evening, everybody. Before I read my letter, I kind of wanted to say that The intent of my letter wasn't to place blame at doctors, nurses, or any staff within the health care or NRHA, I guess. But the intent was just to illustrate some concerns we deal with regularly and illustrate our reality for seeking healthcare in remote communities. So I'm just gonna start by reading a shortened version of my letter. We continue to lose access to basic healthcare services. It is our right as Canadian citizens to have access to healthcare without financial or other barriers. Distance and geography are huge barriers for our community members of Leaf Rapids, especially now during the fast spread of the COVID-19 virus. We are asking for help from provincial and federal governments to address and assist in finding appropriate solutions to potentially life-threatening issues. Since our community has no mayor and council, we do not have an active emergency response committee or an emergency plan in place. Our community members travel at least 1 hour to receive medical treatment, but many of our community members do not have a vehicle. Our community does not have a medical van to transport patients. Many community members who do not own a vehicle are the elders, and they are more vulnerable to contracting the virus. In our community, we believe it is essential to respect and protect our elders. The recent closure of our health center ultimately prevents us from doing so. The community of Leaf Rapids has experienced a lack of health services way before the pandemic. It is a regular occurrence for our community to be without a doctor for weeks at a time. Our normal functioning facility is usually staffed with 1, maybe 2 nurses that rotate shifts in the community. Losing our one and only nurse due to staff shortages in Lynn Lake caused the complete shutdown of the only available health facility. We have no family doctor. When we do have a doctor in town, it's rarely ever the same doctor. So this makes it extremely difficult for doctors to diagnose medical issues and provide accurate methods of treatment. Most times, patients become discouraged because of inaccessible medical treatment. They prolong doctor visits or dismiss medical issues, resulting in unnecessary increase of the effects of these issues. Without our health facility, the nearest community in any direction is 100 kilometers away, with nothing in between point A and point B. In some cases, people from remote northern communities are required to travel from one end of the province to the other just to receive required treatments. This can mean you must travel a 10 to 12 hour trip for an appointment that could take only 1 hour. Medevac by air is not an option for us. There has been zero maintenance to the airport runway in some time. There are no lights on our runway, so planes refuse to fly in at night. So just take a minute to imagine that you or someone you love was in dire need of immediate medical attention. Now imagine traveling 1 hour to see the nearest doctor. If your illness or injury is too severe, you'll be waiting there till a plane can arrive to medevac you to either Thompson or even Winnipeg. By this point, you could be dead. This is the everyday fear and reality for the community members in Leaf Rapids, Manitoba. As concerned citizens of Leaf Rapids, we're asking, we're begging that our health and well-being finally be taken seriously. Our elders, fathers, mothers, children, and pregnant women should not have to relocate to seek medical treatment. When people do not have when people do not have a vehicle or means of transportation to access healthcare, they neglect their medical needs. Many people cannot afford the cost of the trip. Could you imagine this as your reality? We're asking for assistance to address our concerns immediately. This letter is also our community's long overdue cry for help in addressing these long-term issues of inaccessible healthcare in our community, as well as other northern communities across Canada. We ask for assistance in finding long-term solutions for staffing health facilities in remote northern communities. Help to guide us safely through this pandemic. Think about your loved ones. Would this be an acceptable solution for healthcare in your community? What if you lost someone you loved prematurely because you could not access emergency or even basic healthcare? This is unacceptable. We're asking for equal accessibility to healthcare province-wide. Please do not let our cry for help be silenced any longer. We need help now more than ever.
Thank you, Liz. Your letter is extremely powerful, and I hope that people listen to it with an open mind and an open heart. I know that it moved a lot of people who read it on my team, and now I'm going to invite our other speakers here to respond to your letter and to also share some information with you. And if you're able to stay with us, then I would like to come back to you later on. So I'm going to introduce you now to Dr. Barry Lavallee. He's our Chief Executive Officer of the health entity KIM. Dr. Lavallee, please go ahead.
Thank you, Grand Chief, for that prayer. And thank you, Liz, for that moving acknowledgement of what's going on currently in Leaf Rapids. So I'm the CEO for Kiwetinook and I've been working with this particular organization, I believe, for just over 2 years. I am Métis from St. Laurent, Manitoba, with a descendant also of Lake Manitoba Reserve, as well as Pine Creek and Duck Bay. So I'm a physician, and I have a training in community health sciences, as well as population health sciences related to the health and healing of First Nations in Manitoba and across Canada. And I spent a number of years training physicians to deliver culturally safe and racism-free care to our cousins across this province, Canada, as well as in Australia and New Zealand. And I'm very interested in working with you, the citizens of Leaf Rapids, and we will make this in our organization one of our top 3 commitments to move forward in an aggressive and assertive manner in partnership not only with MKO, but also with the community of Leaf Rapids, as well as the NRHA, and including the Manitoba government. What I'd like to say is that this is not the first time that we've been approached by Leaf Rapids leaders, as well as our surrounding communities who've approached us since the clinical services were down again. We did this, I think, about over a year ago. And what we did was we have a system set up for the pandemic. That's a First Nations leaders to look at how to modify things within the federal and provincial systems and regional health to address assertive care for First Nations during this pandemic, recognizing, of course, and you've probably heard this, that even today First Nations still occupy a larger number of beds at the Health Science Center and the ICU, as well as the higher rate of first diagnoses of COVID. So what that really tells us, and we knew this a long time ago, and that's why the First Nations got together rather quickly about 2 years ago. Immediately we got together to kind of figure out how to ensure that this government, as well as the public health system and the regional health authorities, etc., would attend to the needs of First Nations to reduce sickness and reduce death from this particular foreign virus on our lands. So this is the second time. And this time what we'll do is we will make a commitment to work with you, to work with the NRHA, to work with MKO and other people in developing developing a team of people to work towards a proposal with the Manitoba government and looking at monies to develop with you, with your input, a different kind of primary healthcare system. Now, that may involve doctors and nurses and other people, but when we can establish a system that actually addresses common things people experience, like diabetes, hypertension, colds, bladder infections, depression, any addictions or harm reduction services, it's easier to actually predict the health of a community when you have a robust system. Now, that doesn't mean particularly that we're going to have doctors on call 24/7 in the community. And I know I read some of the data or the information that you have shared with Melanie Ferris as NKO. And I want to thank you so much for taking that time to deliver that information to us. We're going to use it. We're not going to forget it. And we looked at it, and there's a number of themes that came forward. Number one is communications, effective communications about what's available, what's not available, and what to do in case nothing is there. We understand that completely. We've met with the NRHA a number of times on the matter of healthcare services in Leaf Rapids, and so we're aware of that. What we would like to do is certainly community engagement. And it is very difficult right now with the new virus floating around. It's a little bit difficult because right now what we're doing is we're working at the provincial level to ensure there's access to the antibody treatment as well as Paxlovid should anybody become ill and is qualified to receive those treatments. So that is a priority for us as well. We're working with public health and NRHA to ensure there's the best services available for you in your community. And we know how challenging that is. What we would like to do, we need to find ways to hear you, to listen to you, to be able to help us together form a proposal that we will take on the writing and submission for that. But also what we would like is for you to think about what we would like is we would like 4 or 5 members of Leaf Rapids to work with us. And we'll certainly support you to do that. And that'll be really vital for us to be able to have a tie and information coming from Leaf Rapids to be able to ensure that our work reflects that. When time is right, Dr. Emerson and I will be traveling to spend 48 hours with you at Night Over, where we can have community engagement, perhaps speaking with some of the elders, and if it's safe, going to do some home visits to be able to listen to our shut-ins in Leaf Rapids and get a sense of the history and the development of that particular community and kind of where some of the origins are for what we see today. We certainly, I am an expert in Indigenous specific racism. That's part of the work that I do in Canada. And what you see right now is a consequence of Indigenous specific racism embedded within the structures that attend to our needs for service, health, service, justice, environmental health, and a whole slew of things. I want to share with you, residents of Leaf Rapids, that you have done nothing wrong to be in this position, okay? You've done nothing wrong. And what I see with Leaf Rapids speaking to me is that you got some very, very good leaders there, but you're having a hard time because the structural racism that denies you access to internet and to other services, including, as I understand, delivery of mail services, condition of the road going up and down there, it's dangerous, no lighting on the runway. So we're well aware of this and we're going to work extremely hard. Some of our philosophies for Kim arise from a lot of work done by our chiefs and councils, as well as our leaders in communities that have conveyed to us. Family is first. We believe in the health of our babies. We believe in eliminating violence against First Nations and other women in our communities. And we believe in engaging in spirituality, a return of our language. All of those kinds of things are like really good medicine. They're better than me giving you an antibiotic for a little cough for the communities. I also want to share that I can't imagine how lonely it is and how frightening it must be when you feel like you're going to be ill and there's no way to get anywhere. I can't imagine how that is. We are going to work on travel, transportation, a whole wraparound service in collaboration. Okay, this is going to be taken on fairly quickly. So I'll ask you to think about things. I'm going to be reaching out to a few of the leaders that I know in Leaf Rapids to try and pull together a team that we will support. If we need to gather in Thompson, we'll bring you to Thompson so that we could do a few days of work together to start itemizing where we're at, where we need to go, and make sure that this process to get a system together in Leaf Rapids is not top heavy, but rather originates from the lived experience of people in Leaf Rapids. We believe in First Nation sovereignty, even for our cousins who live off our reserves. So sovereignty as an undertaking in this process is very important. We also believe in our knowledge keepers and our elders who can actually help guide us in this process. But we also believe in the moms and the grandmas, the aunties and the cousins, like Liz, who took it upon herself to take a risk in getting this letter, to working in the community to say we should stand together and demand help. I don't promise you any miracles, but when I have something on my mind as a CEO, I will work like a dog to get it done, and I promise you that. So the key thing here is that we have to work within systems. We have to work with NRHA, with the province of Manitoba, with the federal government, the municipalities, etc. We need those partnerships to be able to influence them, to release resources and monies so that we can actually find the solution that Leaf Rapids residents and citizens believe in. So we're going to find paths of communication and a regular source of communication, be it on NCI, to keep you updated. That is a commitment by MKO and Kim to you, the residents of Leaf Rapids. We'll find, as well with Melanie Ferris's expertise, we're going to find other mechanisms to ensure you receive the information update and in a transparent way, because we need your feedback, and we're going to make it easier for you to give us feedback, not only to Kim and MKO, but deliver that kind of feedback directly to the systems that receive money on your behalf to deliver health services. Just quickly as well, currently we haven't submitted that yet, but we've done a proposal for actually Thompson General to examine 4 particular domains to address Indigenous specific racism as it's actioned in the hospital, outside the hospital. And we're going to work closely with our partners to ensure that when you go to Thompson General, that one of the key things we're going to do is that you will go and you will receive services. You will not be accosted by stereotypes or angry healthcare workers or anybody else, but will ensure that the services that are there for you will deliver the services they should be in a racism-free and a trauma-informed way. We know that a lot of our people, Métis and Indian people and Inuit people, come from a long line of trauma and violence, not related to violence so much in the family, but violence that's actually predicated or violence that sits on the systems that are supposed to deliver health services to us, policing, etc. We realize that. We realize it is a challenge, and we respect that, and we're going to be as respectful to you as possible. And we do ask through these processes, if there's anything that you're unsure of, please reach out, and we'll send information for you to reach out to us, and we'll clarify, and we're willing to change to reflect your needs. Okay, this is very, very important. So I want you to know that there's many of us outside of Leaf Rapids who are thinking about you every day and working behind the scenes to move things forward, to place things in such a way that your voice will be amplified through this process. So you're not alone. I'll guarantee you, you'll not be alone any longer. And I think that is it particularly. And I want to thank also Liz again, but I want to also thank the chiefs, our chiefs, who've been reaching out to us quite a bit in the last little while, asking us to give a hand to support Leaf Rapids residents. So I thank you so much for your patience and support. And we're working on the pandemic as well, but this is a priority issue that we're going to work with you to rectify. Egusani, Miigwech, merci, merci, and thank you.
Thank you, Dr. Lavallee. I see there's some comments on the Facebook stream that says, they say you're giving a lot of hope. You're providing hope for people. So I think that's really nice to see that. And I hope that, you know, the Leaf Rapids citizens found what you shared to be of interest and useful. And I think that, you know, we have some other speakers coming up who they will also find very interesting and useful. I just want to share quickly that Dr. Lavallee referred to a survey that we have online right now. And we did have a number of people completed it. So thank you very much. The survey is still open. So if anybody has internet access and is able to fill it out, I'm going to give you the information on how to access it. It's at surveymonkey.com/r/Leaf Rapids Citizens. And if you want to fill it out, you can provide us with some feedback on sort of what you would like to see for healthcare in Leaf Rapids. You can also email us your comments or request a survey from us via email. And our email is info@mkonorth.com. That's info@mkonorth.com. And now I am going to invite Dr. Yvette Emerson to provide some remarks to us. And please go ahead, Dr. Emerson.
Thank you, Melanie. And thank you, Grand Chief, for taking this issue on and kind of bringing it to the forefront. And thank you, Liz, for your letter and for your leadership and your courage. And your letter is a big part of why we're all here today. Like you partly made this happen. I'm a Métis physician from Camperville and First Nations registered with Sandy Bay First Nation. I traveled to Leaf Rapids I had the opportunity to travel to Leaf Rapids for the first time the first week of January. My reason for going was to try to expedite the reopening of the health center when it was supposed to only be closed for 2 weeks up until January 10th. And then unfortunately, after I was there for three days doing clinic visits, the nurse had to be pulled to Lynn Lake to kind of keep that facility open, and you closed again until this Monday. I would also like to acknowledge Jessica and Carolyn at the Leaf Rapids Health Facility for welcoming me and orienting me and for being kind of the stable presence and the continuity in the community and dealing with uncertainty. Even when I was there, it was easy to see, even the people working there don't sometimes know. Things are changing so quickly. Are we getting a nurse? When is a nurse coming? When is the nurse being pulled? So they're dealing with that on a day-to-day basis while they try to be there for you. I like some of the things Dr. Lavallee said really resonated with me. I wouldn't have thought to say kind of the poor conditions that you've expressed in the survey are not your fault. Like I wouldn't have thought to say that. I think that's really powerful and important to say. And you deserve better. You deserve like the best quality healthcare that you can envision and you can think of. And you can create a better system of wellness than the NRHA can come up with and that even we can come up with. And that's why we want to engage with you. And that's why Dr. Lavallee has said that we are committed to engaging with you. The best system will be the system that you devise and that you have control and ownership over. And like Dr. Lavallee said, we're committed to be here and to be a resource to you and to help make your vision kind of come to reality. I loved traveling to Leaf Rapids because I love the North, and I think it's also really powerful for me to see firsthand. It's like to travel that road and to ride on that road and to see the distance. And I can confirm all the things that you wrote in your letter just from having been there 3 days. The things that really stood out to me was the distance, the cost. People don't have cars. My taxi ride from Leaf Rapids back to Thompson was $500. I hear the going rate is $300, but Northern Transportation reimburses you after the fact for $212. So then you're still out like $90. And that's a lot of money. And I will confirm from the patients that I saw in the charts that I saw that people do delay care, so that when they seek care, they're at a later presentation in their illness. I even saw a 9-year-old girl who had never had an eye check, an eye exam, and that's not okay and not right in this day and age in a rich country that we live in. So yes, the distance, the cost, and also what it sounds like a small thing, what really troubled me was the brand new x-ray machine that was taken out a year ago and removed. Like, I don't understand that. X-ray is something that Kim put into all the First Nations nursing stations. We updated from film to digital. It's a small portable machine, and there's no reason why there's no reason why you can't have X-ray in Leaf Rapids. So you don't have to travel for a simple thing. COVID testing, you should have COVID testing there. And that's something that we're working on so that you can have access to these new therapies. And the continuity, I would agree, there's no continuity. The NRHA is providing the virtual visits 3 mornings a week now instead of 2. So people should know that they can still call. And while we're working on a better system, they can have access to the doctors in Thompson. But yes, it is hard. From the charts, people did see a different doctor almost every time. Occasionally there was the same doctor twice. In the survey, I would echo a lot of what you wrote in your letter, Liz, that there was a lot of fear and worry about delayed care, about what if something bad happens. Yeah, and I will just end with saying there is a better way, and that better way will come from you, the residents of Leaf Rapids. And I do want to get back to Leaf Rapids in the summer, not in January. Thank you.
Thank you, Dr. Emerson. And now I want to invite Grand Chief Sethi to respond to what he's been hearing so far. Grand Chief.
Thank you very much, Melanie. And I want to thank Dr. Lavalley and Dr. Emerson for being on this call. This is a very critical time in our nations, and also the pandemic has really shaken our communities, but I'm thankful that our leaders are very strong, and our leaders have been very proactive as much as we can to be able to mitigate the impacts of COVID in our First Nations. And then we have situations that are very dire, such as the case in Leaf Rapids. And I just wanted to say to the citizens of Leaf Rapids, our relatives that are living there, that you have been in our hearts, you have been on our minds since last year when they first shut down the clinic. And I'm very thankful for the support that we've had from Dr. Lavalley from the get-go, because first and foremost, the province of Manitoba ceased to have governance in Leaf Rapids. And I think that they were suggesting that everybody move back to where they came from. And my first reaction was that's not going to happen. It's not going to happen, because I know what happens when people are displaced and dispossessed of their environment, because it causes all kinds of social conditions. And I've seen that happen in our history where people have been located, because Leaf Rapids is the home of many of our citizens, wherever they come from. They may come from Matthias, Colomb, Mississauga, Upipuna, Granville Lake, but that's their home. And that's where they chose to stay, and they don't want to go anywhere. So the province were suggesting that everybody go back, but that's not an option, never was an option. And we started advocating to try to figure out a better way. And then we're still working on that issue. But in the meantime, we hit with COVID, and the things that have started happening in Gillam and Leaf Rapids have been on our hearts. And Dr. Lavely has been very proactive and very assertive in ensuring that there is a plan in place, and that we stepped above and beyond the call of duty to try to address the situation from last year when it was first shut down. And we were able to figure out a way when other people seem to have written Leaf Rapids off. Our team never wrote off Leaf Rapids because I believe they were worth fighting for and they were worth advocating for, because these are our citizens, these are our people, these are our relatives. And this is something that we cannot simply just stand by and watch this happen, because the people that are there are precious. They have human rights just like anybody else in Canada and in Manitoba. And for me, it is unacceptable that a community is abandoned by the system. It is unacceptable for people to be without emergency medical services and the quality health care that is offered to every other citizen in Manitoba. It is simply unethical to just wash our hands and let these people fend for themselves. That is appalling that we live in a country such as Canada and live in a province such as Manitoba, that we even contemplate just forgetting about this little community. And that's something that it disturbs me. And it's something that I will not accept. And we will continue to ensure that things are happening in Leaf Rapids. And it may not happen overnight, but we're going to work towards a process where we start to see things happening. And I'm thankful that they're open right now. But I am also concerned that the ongoing services will continue to be there for people in Leaf Rapids. And so this is something that I am really passionate about. And but the team that have been working with me have been instrumental in creating those necessary steps to see that things are happening. So thank you, Dr. Lavely and Dr. Emerson, for being so caring and compassionate towards our people, because without that, I think that nobody would be looking at Leaf Rapids. So I just want to thank you. And so another thing that we need to think about is that 580 people live in Leaf Rapids and they don't have a health facility or health center that is operational. And I can dare say across Canada, there's communities that barely have 100 people that have a health center, a hospital within their communities. And I think that the way that our Indigenous people have been perceived or treated is simply unacceptable. And I see a lot of that, the racism that exists in the system is still prevalent. And that is something that we want to change, that we can look at small communities all across Canada that are smaller than, that have a lesser population than Leaf Rapids, that have these facilities. So there's something wrong with that picture. And we want to ensure that these people have the opportunity to have those services regardless of who they are and where they are. And that's something we're advocating for. And so I think that moving forward, things have been happening in incremental steps, but we did agree that as a team at MKO with Kuwaitan Ininu Minoya, that doing nothing is not an option. Like just wishing that the problem will fix itself, it's not an option. And hoping that this problem will go away, it's not an option. It is something that we want to see happen. We want to change the status quo. And I think that we have the determination from our organization to ensure that our citizens receive that kind of care, and we will not stop. We will not stop to continue to advocate for our people in the North, and especially when it comes to people that are being abandoned. I just want to say to our people that we're working very hard to ensure that your cry is heard and your concerns and your fears, we feel them, and we want to ensure that we're here to walk with you on this journey to see a better scenario for you. So thank you, Liz Charrier, for the letter that you wrote. It's very heartfelt, and also there's people that have been advocating on social media for Leaf Rapids. I appreciate the people, and we are concerned about our elders there to be able to be able to help the elders, you know, that are very vulnerable, and especially young children too, that are very, very vulnerable during this pandemic. This is simply unacceptable to have a system that has failed them. But I don't think that we can afford to fail anybody here. So we reach out, and I have also made an attempt to meet with the minister responsible for health here in Manitoba. We have written to her, and she has not accepted our invitation, but we will meet with her. I will meet with her, and she will hear from me, and she will hear from us to let her see what's happening on the ground. And it's easier for people that are sitting in the cozy comfort of their offices to make decisions for people that are off in the further north and in the north region, and not really having the able to understand what's happening to our people. So we're going to continue to advocate for Leaf Rapids. And also I want to thank everyone that has participated in the surveys and trying to hear what your thoughts are, what your feelings are, what your aspirations are. And I'm thankful that the health center is reopened, and but we want to continue to advocate that that there's an ongoing provision of healthcare services for Leaf Rapids. And so anyway, I want to urge the provincial officials to work with MKO and Kim in the support and health and well-being of our First Nation citizens in Northern Manitoba, and most particularly in Leaf Rapids. So let's work to ensure that the people of Leaf Rapids are not forgotten. So our concern is still for the safety, the welfare, the health, and the well-being of our MKO citizens. So I'm thankful to be able to speak to you. Kinanaskumit now, gaginaw tutamig, ketiatisak ininuag. Tapos epaguseni moan, kitawitsiguisiek, mistaynatuscanan, tapetagusiak, kitananagaten tagusiek, takanop migaek, queskise, egusi kinanaskumit now. Aho.
Jose, Grand Chief. So we're at 7:43 p.m. and we're scheduled to go to 8 for sure. We can go a bit longer if necessary, but I just want to share a few things. I am looking at the comments on Facebook, and I want to acknowledge Dennis Anderson. He is a citizen of Leaf Rapids who has been instrumental in bringing these concerns forward. And he has very kindly offered to assist Leaf Rapids residents who would like help in filling out the survey that we have. So if you need help completing the survey, feel free to reach out to Dennis. And I also want to acknowledge that, you know, at MKO, we have quite a small team, but we're a very mighty team. And there's several people that I want to acknowledge before I move on to ask Liz to provide a response to what she's heard. I want to acknowledge my colleague Brenda Wood. She's our senior health analyst. She's been working very hard behind the scenes in trying to assist Leaf Rapids. And she has been able to arrange the delivery of masks to Leaf Rapids. And the delivery was made possible thanks to the Grand Chief's assistant, former Chief of York Factory, Ted Bland. He drove all the way up to Leaf Rapids and back within 2 days, and he delivered thousands of masks. So maybe I'll ask Liz to share a little bit about that. And I just want to thank Ted for making that long drive. I hope that you know, I hope that that action shows how concerned our team is about Leaf Rapids. We are also trying to get the rapid tests, the COVID tests into Leaf Rapids as well. And I also want to acknowledge our executive director, Kelvin Linksleg, because she's working hard behind the scenes as well, trying to make things happen for Leaf Rapids. So in addition to many other people, I want to now just acknowledge there are some comments on our Facebook live stream from various people mentioning the boil water advisory in Leaf Rapids. That is definitely something that's been raised a few times as a concern because definitely the quality of water affects people's overall health and well-being, also housing and road issues. And now I'm just going to ask Liz if she would like to respond to any of what she's heard. And then after she responds, then I'm going to go back to Dr. Barry Lavallee.
Okay, I want to thank the MKO for everything that you guys have done for us. And even this session tonight, I mean, it's given a lot of people hope. I mean, sometimes we we put off our health concerns because we know it's going to be, it'll be an issue to try and get in there. Or is it too busy? Will they see me right now? It's not that they won't see me, but will I have to wait? There's only 2 nurses sometimes only 1, you know, and they're human beings. They are being overworked. And even a doctor who comes to our community is being overworked because they're there for 1 week out of a whole month. And that's a whole month that this community is waiting to get in to see a doctor. There are a lot of people that need to see a doctor. And in that 1 week that the doctor's there, half the time you can't even get an appointment because it's booked before. And you know, I have kids and I can't get them regular doctor visits because when there are doctors in town, there's so many people that need to see the doctor, you know, and if it's not an emergency, I don't want to overwhelm that little bit of service we have, you know. So my kids, I have 2 kids, 2 and 6 years old, and my daughter is 2 years old. She was born right as the pandemic hit in Canada. And I have yet to really get her regular visits to the doctor. So how can you be on top of anything, right? You know, that's causing kind of situations where things can go bad really quick if you don't know, you know, if you can go regularly and be on top of things and do blood work or tests, then you know where you're at in your health. And I have to go to the health center for myself. I've been going for many years since I was 11 years old. I've had really bad back pain, and still to this day, we figured out a few things that are all probably playing together, but overall, I don't have a solid method for pain. So I'm taking Tylenol taking way too much Tylenol, you know, that to the point where it doesn't help me, you know, like, and that when you go to the health center, a lot of the times, unless you have imaging, until I had imaging, like I had an MRI, I wasn't able to get anything other than Tylenol for my pain. So now that I have that, now I'm able to, they'll take it seriously. It's, you know what I mean? And when you're seeing someone different all the time, it becomes frustrating to recap your medical history every time. Things get forgotten and things are overlooked that might be a key into figuring out the overall issue. Like, I feel like this is not an effective system, and we're probably overwhelming our healthcare system because it's not effective. You know what I mean? So I just want to thank everybody here that spoke tonight, because everything you guys are doing, it's awesome, it's amazing. And I can speak on the behalf of my community. I know everybody is very, very greatly appreciative of everything you guys have been doing. I know we all received face masks yesterday when we were shopping. I got a box of face masks thrown in my bag, so that's awesome. Now I have on hand a box of face masks, which, you know, they're hard to come by before that. So I really appreciate that, and everything you guys have done to help. I really, really appreciate it on the behalf of my whole community. Thank you.
Thank you, Liz. And I just want to, you know, acknowledge all the work that you've done as well. And thank you so much for sharing with us and for being brave enough to come on the air and share with us as well. I know it's not always everybody's favorite thing to do. So thanks for joining us. And now I want to ask Dr. Lavallee if he has some more information he'd like to share.
Thank you, Liz, again, and Grand Chief Seti for those messages of hope and positivity. And I just want to finish a thought because it's really important for the citizens of Leaf Rapids to know that Métis and Indian people, First Nations people today, we're the doctors now, we're the CEOs, we're the PhDs, we're the masters, we're expert in many areas around social health, well-being. We're surgeons, we're bone surgeons. There is an increasing number of us that we're supporting our kids, your kids, to become healthcare providers, to become nurses. So keep that dream open for the kids, because we're going to find paths to the medical schools and nursing schools across this country. It is your right to develop workforce from your community who understand your culture, understand your history, understand what racism feels like. But, you know, last year or 2 years ago, when we first got together as the virus entered into Canada, a number of Métis and Indian scientists got together to consider the structural racism that First Nations and Métis are placed under by provincial and federal systems, and consider what would this virus do in such an environment. And as a result of that kind of advocacy, we put together with other First Nations leaders and Métis leaders, the pandemic response team, which is a First Nations pandemic response and coordination team that we've been meeting mostly for the 2 years to be able to influence the governments and work with the governments. And we developed something called a rapid response team concept to go to communities should there be an outbreak or should there be a need for extra vaccinators. And so when we got a call from some of our chiefs at the first time when there were no primary care services, we deployed a rapid response team that was coordinated by First Nations and Métis people. And now it wasn't completely successful because the system that's up there is a provincial system. It's a regional health authority. They have their own regulations about who could practice, who cannot practice, all of those kinds of things. But nonetheless, we got some people up there and pushed the NRHA to do what was its responsibility and remains its responsibility to provide services to you. So we do, unlike 50 years ago, we have resources. Even the resources are trained minds in our communities. We know the systems, and sometimes we know the systems better than they know the systems, okay? We know the science of medicine better than a lot of our colleagues who are white, okay? Relative to our communities, all right? So know that we have some resources, not particularly great like the colonizers who come to our land, but we're getting there and we're going to work on that. And really one of the things I wanted to say is this is not, besides we're talking about how difficult it is for you, I'm not undermining that, but through the next processes, as we're looking at putting a proposal together for money to develop a system that's reflective of the values, the ethics, and the needs of people in Leaf Rapids, I want you from this day on to dream of what you want. I don't want you to survive. I want you to thrive and create, okay? So you deserve the best the world can offer you. And that's what our fight is going to be, okay? So dream about what you want, okay? And what you need. And our job as health technicians is to facilitate that. And as advocates on your behalf is to facilitate that. And we're a mighty group of people and we don't back down, okay? We're not afraid, we're very assertive, we're very articulate, and sometimes we know English better than the people who are English. So we've studied a lot over the years to ensure that we can convey the strengths of this healthcare system so it can match and meet the needs of our community people. And that's who we are. So please be kind to each other. Wear your face mask. Try not to mix too much as the time goes on. Try and eat as well as you can. For those of you who are taking medications for diabetes or for other conditions, please take the medication every day. I know it's hard right now to get your meds, but work hard, and we could work hard with you to ensure that you get your medications. But if we do these kinds of things and try and stay as healthy as we can, even mentally, like praying, visit the elders, people who are shut-ins in your community. Just go bang on their door. You don't have to go in, just to say, how are you? Bring bannock, bring some food over, and just make sure, because loneliness right now actually decreases your physical health. So you've got to, if you got the energy, please say hi to people, be kind to people. And if you have any troubles with addictions, with alcohol or drugs, reach out, because we're developing an expertise at Kim and MKO to support our community people through the traumas that they actually feel without judgment. So please reach out and do not be afraid, okay? We got your back. We're a little bit of ways from you, but once things get better, we're gonna come visit the Leaf Rapids. We'll have a feast or do some feasting, and we're gonna only be ears to you to listen. And we'll document what's saying, because I'm gonna get a big file on our information that is you. Thank you so much. Melanie will send information out. We're going to do this regularly. We'll find the timing to do this regularly, just so we can update you each time and get more reflection from you. Once things get better in terms of this ugly winter, we're going to come up there. And once I'm feeling better, I'm going to come up there and visit you. Okay, we're going to make that happen. So please hang in there. It's really tough right now. We're looking for the peak of this new virus. But be safe, okay? Be safe. Get your vaccines, okay? I know some of you don't like that. I know it's scary, but it's the only thing that we could see right now in the literature or in the information we have from Dr. Marsha Anderson, who is our Chief First Nations scientist for this pandemic, that getting the 3 vaccines reduces the likelihood that you will be hospitalized should you get one of the viruses, and certainly is about 64 times reduction in death from this virus. So please, if you're afraid, go with your friend, go get a vaccine. Support people to do that, okay, when it's possible. Thank you so much and have a good night.
Thank you, Dr. Lavallee. I always find your words very inspiring, so I hope that other people do as well. I'm sure they do. And it's amazing to be able to have access to you as an expert on Indigenous health. I'm just going to say a couple things, and then I'm going to ask Grand Chief Sethi to close us off. I just want to acknowledge NCI FM for broadcasting our session this evening. I hope we were able to reach a lot of people through radio. We are very cognizant that access to internet in our northern communities is lacking. And it is a major concern for us. I mean, we're almost two years into the pandemic now, and you know, our children need access to high-speed internet. People who need to work from home need it. There's so many people who need internet access. So that's something that we continue to advocate for. But in the meantime, we will try to find ways to reach citizens through radio or through in-person posters, letters, that kind of thing. I do want to acknowledge 82-year-old elder from Leaf Rapids, Minnie Anderson. I received a picture of her. She was watching the broadcast. She's probably watching it still. And I know we're all happy to have you watching. And I'm sorry that you are not able to access healthcare in your community like you would like. I did receive a note that you're very lonely and wanting to go back to your community. So I hope that, you know, we can reinstate health services in a way that makes you feel safe to go home. There was one other thing I wanted to mention, and that's, I just want to acknowledge our Zoom driver tonight. She's working behind the scenes. That's Jaden Sandberg, and she is also instrumental in helping us with our survey that's online. So if you missed that information at the beginning, there's a survey on SurveyMonkey. You can Google it, SurveyMonkey Leaf Rapids. If you have time to fill it out, please do share some of your thoughts with us on healthcare in Leaf Rapids, or you can email us info@mkonorth.com. And we will continue to try to share regular updates and information and try to engage with Leaf Rapids citizens. And now I just want to ask Grand Chief if he can close us off in a good way.
Thank you very much, Melanie. I want to thank everybody that took the time to be with us on this very important conversation that we're having, advocating and thinking of our relatives in Leaf Rapids, but also thinking of all the relatives in our north, and I realize that there are many people that are going through various things in their communities. There's a lot of bereavement. COVID has really impacted our First Nations, and I want to acknowledge that there's people that are mourning right now the loss of a loved one. I come from Pimicika Nation, and I want to acknowledge that my chief also for his leadership, because I know that our community has lost a lot of people in the last year, and even myself, I can say that many of my relatives have been lost because of COVID. So we identify and feel the pain of our people that we're going through this. And we want to offer our condolences to all of you that have lost a loved one or seeing a loved one being severely impacted by COVID. Our prayers and our thoughts will be with you. And we want to acknowledge all the care providers and all the leadership in the community, be it pandemic response, health directors, and pandemic teams. We just want to say thank you for the sacrifices you make for the safety of our people. And I know that even the people in the front lines get sick too. I know people that have contracted COVID-19 because of reaching out and trying to help people. And it's a sacrifice and putting our lives on the line. And the lockdowns have been very hard mentally and emotionally for our people, and especially our youth that are not used to being confined. And so our prayers are with you, but we will get through this. We will get through this. There's a saying that goes, this too shall pass. Nothing lasts forever. Nothing lasts forever, be it pandemic or be it any situation that we are going through. Nothing lasts forever. So our thoughts and our prayers are with you. So thank you, everybody. Our prayers, our thoughts are with our nations in our MKO territory, and also thank Kuwait and Inuyawin for the services they provide for our people. So I want to thank everybody that is listening. Paguseni mon mantuta soy nimiguega gino Minoyawin nigise kimamitunen kiuwa kitatsagwak ketiate sagta tamiskawak knaspikisteni mitnan. Pag-usayin mo na o si Meta Minoya, gagawin na nas kumuha ng